Sensei, thank you very much for being with us.
Sure.
Let me start with the questions. While most of the world is locked down, millions of people are staying home, worried. Japan seems to be like a paradise. People still go around, take trains, eat outside.
Yes.
What do you think is the matter here? Are Japanese people some kind of immune to the virus, or there is a misperception of the emergency?
Well, I think it's a misperception mainly. So a lot of people do not recognize this as a serious risk to human being and the society. So the people, because virus is not visible, and sick people go to the hospital, which we could see, but not most of the people in the society. So most people, unlike earthquake or tsunami, where the damages are so visible, viral infections are quite invisible, and you can't really visualize how the risk is. But that is not unique to Japan. So every nations do have the same thing. So you can underestimate the issue anywhere in the world, unless the government or the policy makers do let people know how serious the problem is.
Yes, Sensei, that's exactly what I would like to lead. When you boarded the Diamond Princess, you came out with a pretty much strong statement saying that the bio-containment of the situation was less than satisfactory, to use an euphemism. How do you rate the Japanese actions up to now? Satisfactory, less than satisfactory, awful?
Well, it depends. I don't call it completely a failure. I don't call it a complete success. Some of the measures were quite taken nicely, and some were not working well. So I can't generalize everything as good or bad. A lot of local government and the central governments are doing their best to contain these epidemics, and some are working well. But probably since this month, when the infection skyrocketed and the number of people with infections increased, then Japan began to have more inadequacy in terms of the containment. And this is the typical Japan's lack of plan B, where the Japan is very good at following the initial plan, and everybody will follow what the government or ministry said, and they are very compliant with all the documents and rules. So as far as things are going well, everything will go well. The problem is if the things went wrong, nobody can point it out and ask to change the strategy. And if you ask them to change, they will dislike you because they are just harmonizing everything. So if somebody is against, that will disrupt the unification of the society and harmony, and that would sometimes will lead rejection of the person from that team. Like I was kicked out of the ship.
Sensei, let me ask you very abruptly one question. Yesterday, NHK reported about the worst scenario possible, 800,000 infected and 400,000 deaths.
Yes.
Is that a likely development?
No, I don't think so, because that's a calculation by Professor Nishura. who is a mathematics and mathematical model specialist, and I know him very well, and he's extremely good at modeling. But his assumption is, if things continue to be like this without any additional intervention, then these things will go that wrong. So that is his caution.
Okay, but let me just ask you, if a part of the scenario, the worst scenario, but the fact that half of the people that got seriously infected could die,
yes,
is that possible? Does it mean that Japan sanitary structures are not up to date?
Well, it's nothing to do with the sanitary, because his assumption is the half the people who got seriously ill would die. And that's largely the same everywhere in the world. New York City, Italy, Spain, United Kingdom, China. About 80% of the people with coronavirus infection would recover spontaneously, meaning you don't need anything and you will get better. Only 20% will get seriously ill, and some go to ICU, and some get intubated with a mechanical ventilation. And approximately half the people with seriously ill people would finally die. And
Sensei, is that true that the Japanese ICU machines are so low per 100,000 people? I heard that it's 5 out of 100,000 people. Italy has 14 and Germany 30. Is that true?
I don't know the exact number, but it is true that Japan lacks both the ventilators and the critical care specialists. So you both need ventilators and other equipments, as well as the ICU care specialists. Ventilators could be ordered and produced by the manufacturers, but the specialists are not. It takes years to become specialists. So Japan lacks the capability of taking care of seriously ill people.
Sensei, suppose you are an expert. You have been involved with Ebola, SARS.
Yes.
Suppose that you were the top advisor of Mr. Abe. What would you advise him today to do?
Well, first of all, I would like to advise him to rationalize the policy and see the reality, and stratify the risk, not the ideology, not the euphoria, and not the dream, but the fact is extremely important. Also, there is the controversy between which one you take the priority, economy or coronavirus outbreak management. In my opinion, that is a wrong question, because unless you overcome coronavirus infection,
the economy,
there's no economy recovery. So
okay, so basically, would you advise him to stop the trains, to ask people to shut out every restaurant and bars? I mean, to do a proper lockdown.
Exactly. Well, I would ask him to do the proper lockdown. Japan's law does not have that legal, how do you call it? Can't enforce the people to do that. And there's no penalty against. But still, you could ask people to stay home.
Exactly. In Japan, the country
to stop the train. So you can request.
Yes.
Without obligation, without any penalizing anything. Still, you can deliver the message to stop and go for lockdown. So that is what Japan is needed, at least in a part of Japan, like Tokyo and Osaka.
You are lucky people, because contrary to other countries like Italy, for example, we are less prone to obey and to submit ourselves to authorities. That's why we need the coercive measures. We need the police, we need the helicopters checking and drones and so on. But my understanding is that Japan, a strong request would be effective.
Yes, if you deliver the message properly.
Was not properly sent out.
Exactly.
Okay, Professor, Doctor, sorry. What do you think about the initiative of Ishikai? The president of Tokyo Medical Association announced that from next week they would be able to perform so-called private testing of coronavirus. Is it a good initiative, or is it a risk to extend the number of tampons of tests, because that would create panic?
I don't care about the panic, because you have to be with reality. If the fact is very pessimistic, you still have to see that fact, even if that is a catastrophic, bad fact. You can't really hide the fact to make you feel better. That's not that is like you have a disease inside your body and you need an operation to take it out, but you are just taking a painkiller to forget about this disease. That's a wrong attitude. You need to have the proper treatment, even if it could be fearful and it could be painful. You have to do the appropriate way. Now, PCR is good if done appropriately. The one problem Japan has is everybody who got a positive PCR needs to be hospitalized. That rule is wrong, because a lot of people do have only mild symptoms, and even a lot of people don't have any symptom at all. They don't need to be in the hospital. They could stay at home and wait for the recovery, and the majority would do. But because of that stupid rule, everybody with positive PCR needs to go to the hospital and be in the hospital. That would suffer.
Get infected even more. Yes.
Yes, that would make a lot of suffering of the hospital workers, nurses and doctors, and potentially that would be transmitted inside the hospital, and that is happening now in many places in Japan. So it's very dangerous to send everybody with positive PCR to the hospital. That's a wrong attitude. So the government immediately need to change the rule of positive PCR to be hospitalized. Shinjuku, for example, changed the rule that the mild symptom positive PCR could be staying at home. But the Japan's government need to deliver strongly the message to every prefectures that positive PCR does not necessarily mean hospitalizations. Simple, mild symptoms, you could stay at home. Then otherwise, the Japan's hospital will be destroyed by lots of people.
Yeah. Sensei, let me ask you a very ethical question.
Yes.
As a doctor, I'm sure you would like to comment on this. A part of the scientifical and strategical needs, is there a right for any citizen to be checked, even if they are just only afraid, even if they have no serious symptoms, just because I'm an old person and I need to be reassured about my situation?
Well, in terms of the right, I think people have a right as a human being.
Yes.
But I don't think it's appropriate. So I would call it inappropriate to everybody who come to me and I need a test because I want to be reassured, because there's no reassurance by doing a test. So the scientifically, it's a wrong attitude, I would say. But I can't really deny the right of the people. For example, a lot of people coming to my clinic continue to smoke cigarettes. And I can say that it's not good for your health, but I can't really say you don't have a right to smoke. So between the adequacy and the right, there is some difference. I can't deny the human right, even if it's wrong. Do you know what I mean?
Yeah, thank you very much. My last question, Sensei. I'm sure you're aware of the fact that the Avigan drug has been causing a lot of uproar abroad, including Italy. Can you tell us exactly what is the situation in Japan with this drug? Namely, is it used already routinely? Is it just tested and among how many people? And if it is true that Fujifilm cannot produce it right now in Japan because it has sold the license to a Chinese company?
And the last question, I don't know. I have no information about that.
Okay.
Is it used? Yes. I don't know the every situation, every hospitals in Japan, but surrounding me, hospitals which are taking care of COVID-19 often try Avigan, particularly for severely ill patients. Without clear scientific evidence, without clear benefits proven, but because the respiratory failure could be very long and some people would continue to deteriorate. So the doctors just give Avigan or other medications without assured clinical benefit we can foresee. Not everybody gets Avigan, particularly for mild symptoms. You don't need any medications. Also, clinical trials are ongoing, particularly with the Fujita Medical University.
Yes.
So I'm aware that the both with clinical trial and the just clinical management, Avigan has been used in Japan. Would it change something? I don't know. Only 2 papers came out, and the one was taken away by the author for some reasons. And so we have very mild evidence only so far with small clinical trial.
Right now, if you would be involved directly with this, would you prescribe and subminister Avigan to a patient?
Not to everybody. Maybe to some, just for a compassionate use.
Yes.
For compassionate use, remdesivir has better evidence so far. So I might use remdesivir if obtainable. But anyway, there's no single, the IDSA, Infectious Diseases Society of America, recently published a clinical guideline for the use of medications for, one moment please. Hi. 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 どうぞどうぞ、つないでください。はい。
Okay, Sensei, let me ask you a very direct and important question. Do you think that in Japan we have somehow escaped the tragedy, or that we are just entering it?
Well, my answer is we might be entering it, but I said might because we might avoid it either. So we are on the verge of a crisis. We might be the steep increase of the cases and death in the coming days or weeks. But still, for example, Tokyo has less newly diagnosed persons in the last couple of days. That might be the beginning of the decline of the epidemic too. And
but the tests are still very, very low in numbers. Suppose that from next week, this initiative of the Ishikai will go on. Is that possible that tests will?
I'm not foreseeing which way to go, but I have to be prepared for both ways, optimistic and pessimistic scenarios. So I will be prepared for the very pessimistic scenario, which is just to follow what Italy, Spain, France, and New York City went through. Also, I have to be prepared to be the optimistic side too, that we could luckily, for some miraculous, whatever the reason, to see the decline of the cases in Tokyo and Osaka and other areas, which is the very happiest scenario. And because I'm not a foreseer, I'm the doctor who always needs to be prepared for every scenario possible. So that is my answer.
During the last press conference of Prime Minister Abe, I asked him personally whether he is ready to take responsibility should things go wrong.
Oh, was
He
it
said
you?
that, yes, it was me. He said 別に責任取ることは良いことではない。
はい。
Do you think that if things goes wrong, he should take responsibility and resign?
Well, to be honest with you, I don't think I don't have a lot of expectation to prime minister or politicians in Japan. They always say they are doing the right thing. They are always appropriate. They did nothing wrong, and they keep saying that. So I don't expect any wrong words from them. I don't expect any critical review of the issue from them, and I don't expect any wrongdoing, acknowledgement of wrongdoing or resignation or any kind of taking responsibility. And I might be wrong, but my attitude is that I don't expect anything from the politicians here in this country. I don't have any surprise to see the attitude of irresponsible kind of way people in the government do.
In Japan, the era of samurai and bushido is over.
That didn't exist to begin with, possible. And
Okay.
that was the sort of idealism or the legends, perhaps. So the Bushi should act on this is a bushido. Was Bushi like this? I don't know.
Thank you very much, Sensei. Thank you for your time and your work. Please keep it up and help Japan to get out of this.
I'll try. Thank you.
Thank you very much.
Bye.